So Dave, thanks for coming in to do this for us. We're here to find out about your experience with your daughter Lauren that did vision therapy with us here at Roswell Eye Clinic, and just kind of wanted to talk to you about how that all happened, what your thoughts are on that. So how did this start? When did you guys realize there was a vision issue for Lauren?
When Lauren was 4, we all went to Florida on a family vacation. And we had no idea that there was a vision problem that we were not yet aware of. And so we noticed her left eye really begin to turn far too closely to the center of her face as objects came nearer to her. So we didn't know what to think about this condition. She had been kept up with all of her pediatrician visits and was in good health. So the family was caught unaware of the potential for this complication. So we continued our vacation and we started watching her very closely, and it didn't improve or change on its own. So we got back to Atlanta from Florida vacation. We took her to the specialist at Roswell Eye Clinic, and they did a comprehensive exam and were able to quickly determine that Lauren had a condition that derived from her 2 different eyes having 2 different requirements for corrective prescription. And in doing so, basically her visual system had to choose one signal or the other. The difference between them was too great to superimpose them. And so the visual system, she had 2 eyes that worked great, but the delta or the miscompare for her prescription was so much that the system couldn't compensate. This was all unknown to us. We had done a lot of reading on a lot of different parenting subjects, but at a certain point we had to trust in the professionals, and through the pediatric office and through our own close observation. I stayed with my girls for a year after they were both born, and we were in very close contact with them. So it was immediate. When it happened, we saw it right then. Didn't have a clue as to what was happening. A little unsettling. We were unprepared.
So there are a lot of parents that wrestle with the decision. Some professionals will say you need to do surgery for an eye turn or strabismus, and other professionals will say, well, you should probably do the vision therapy. Is this something that you guys had to wrestle with and decide?
We were faced with a difficult decision because of we had 2 esteemed professional communities. Here in Roswell is a fine place to raise kids, as you know, and there's a lot of great physicians and other healthcare providers here in Roswell. And as we researched and learned more about what was going on, the doctors at Roswell Eye Clinic were able to help us quickly understand that this was not something new. It was not unique to her or our family. It was well understood already by their community. However, when we went to get a second, third opinion, we got some differing suggestions on how to proceed. As a helicopter dad, I reacted and thought, well, what if she's got something really bad? So we went and saw a pediatric neurologist. He said, you can stop worrying about that. She doesn't have something in her head. They had already told me that at Roswell Eye Clinic. But they said, hey, be sure and get satisfied. Take her to the neurologist, let's be sure. So rapidly, the support system of experts came online. They offered us a great deal of security in their knowledge and calm, measured perspective. They didn't try to eliminate any possible options. They strongly wanted us to go and get satisfied amongst yourselves before you decide. But they were unequivocal in their reassurance that if you go the vision therapy route as opposed to the route with, for example, an ophthalmologist correction, we can prove to you objectively that this is a good idea. Statistically, we have a great track record at this, and they instilled a confidence in me, my wife and I, that they were going to get this fixed, and we should really not lose a lot of sleep over this. Enormously beneficial.
So what would you say going through the process of vision therapy, Lauren, strabismus is one of the diagnoses that may take a little bit longer to correct if you decide to stay that course with therapy. what was your motivation? What did you think about the process? How was it for her? She was 4 when we went through this. So what kind of feedback as a parent for somebody that's going through therapy with a child?
It's a great point. As parents are challenged with different medical conditions and different growing up events, this confidence that Roswell Eye Clinic gave us as a family was instrumental in breaking down these walls of preoccupation of how to proceed. For me, it was a simple decision after I became educated. We could either go with an invasive procedure, which meant anesthesia and surgery, but there was a non-surgical alternative. Now, both these medical offices had great qualification to advance their positions in the diagnosis and the protocol for correction. But the decision for the non-invasive came very quickly to me. And so we're obviously very pleased that it worked out the way it did. And we recognize that other patients have other detailed conditions, that all of these cases are not the same, and what worked for us is not intended to dissuade anybody from educating themselves and going out and getting these second and third opinions and deciding as a family how to proceed. We can promise you that in our case it worked extremely well, and so consequently that I can testify to.
Great. So what do you think the benefits were for Lauren through all of this? I mean, at the end of the process, what did you see, change, or what do you think she benefited from in the end?
We were educated early on that this may take a while, but that was not a liability as time went on, because we weren't just getting the correction for Lauren's vision issue. She had come to a place of great security and nurturing and mentoring, where she was learning a lot of skills with every visit above and beyond correcting her visual system. She had fun, she was challenged, she was mentored and monitored and loved here. And Dr. Scherenberger and Miss Melissa and the whole staff at Roswell Eye Clinic, they all but adopted Lauren. And they took a very much of course, their moms themselves. They brought that game to the table, and it made all the difference in the world. We became very close with the physicians, therapists, well, everybody at Roswell Eye Clinic. It was not go in, have an operation, and then we'll follow up that way. No, this was an ongoing, and it continues to this day.
All right, so I wanted to jump in the video and just sort of express my thanks, because as a therapist, it's always amazing to help people. That's part of what we're driven by. And when I worked with you, it was pretty early on in my career as a therapist. I didn't feel completely comfortable maybe with everything I was doing, because I knew I was helping and I knew I was taking the right course, but you've got someone's lives in their hands, and vision is such an important part of everything we do in life that at that particular moment in my career I was just a little nervous. I wanted to make sure I did everything right. Yeah. But when we got done and I saw this beautiful young girl with these 2 straight eyes all the time and good depth perception, I knew this is what I wanted to do. You were the reason that I stayed in vision therapy. Aww. So, I think we connect somewhat with all of our patients, but as you guys obviously know, yeah, sometimes you just really hit it off with amazing people. So, I want you to know the impact that you had on me. So thanks for that.
Oh, thank you. Aww.
Lauren, do you have friends at school that would ever have an occasion to understand a little bit more about vision?
Yeah, actually I have one friend that has the same problems that I do, strabismus and esotropia, but she went the surgical route, and I know that happened when she was little. We've been friends since our childhoods, or early in our childhoods I should say, but yeah, she went the surgical route, and unfortunately her eye still turns in. She still has a pretty bad lazy eye. See, it worked for a little bit, but
Have you ever mentioned to her about doing therapy?
I have. I think our families have talked about it before. I don't know if she's gotten into it, but
Right.
yeah.
Well,
It's good to have the option, you think?
It definitely is, because I know for sure going under surgery has big complications that, you know, sometimes things can go wrong, especially when you're having someone's life in your hands. As you said, like, a lot can go wrong. It is definitely a more dangerous route, and the fact that sometimes it does reverse itself, you know, eventually the muscles in your eyes, I guess they just go back to the way they were. I mean,
right.
so with
Well,
vision therapy, yeah, you can just keep working at it, but for surgery, I mean, going back in over and over again, you don't have nearly as much leniency as you do with therapy. So.
Do you think early detection of the condition is important?
Definitely. I mean, I guess I'm no doctor, but I guess the earlier you find these kind of things, the earlier you can get working on changing it before it becomes permanent.
definitely. The earlier we can get in and help make new visual habits versus what's happening, the better it's going to hold in the end. So, you know, definitely good to, there's sort of a misconception about, well, you got to fix it before they're 8 years old, because that's when the eyes stop developing. And that's not really the case. Neurologists have been our friend in all of this with brain imaging, and we know that neuroplasticity gives us the ability to make changes through the entire course of our life. And since the brain is really in charge of depth perception and binocular vision, it's never really too late, which is fantastic.
Is it ever too soon to bring a new child into the office?
No, there's even an infancy program for babies before they're 1 year old, just to get a quick check and make sure, is everything healthy? Does everything look good? Is the reflex the way it should be? So, not at all.
Can you tell a child's prescription before they can talk?
Yes, and for special needs patients that are nonverbal.
So you can quantitatively predict who's going to have too much of a miscompare in their visual prescription.
Yeah, pretty early on.
Does that predict their potential need for solutions later?
It depends. Sometimes you get a big benefit out of just having the correction. The more equal we can get the two eyes together, the better they're going to function as a team. So sometimes just the correction is a fantastic first step.
But earlier is better?
Earlier is definitely better.
And even though it's not, it's not true to say it's, for lack of a better term, parental complacency. If they're doing all the required exams with everybody that's involved in the child's development, and something does not get brought to their attention because it wasn't tested for specifically. I understand former President Jimmy Carter had an interest in this program to the extent that he wanted all mothers in America to know that they have instruments that can tell you extremely early, even like you say under a year old, that this was not something you had to wait until you get to Disney World and see your daughter have a problem. It's not where you want to find out, is it?
Right. No, better to just, you know, you go to the dentist twice a year, you know, to get your teeth cleaned and checked and make sure everything is healthy. It's important to have at least an annual exam, and if you do it with a specialist that does vision therapy, if there's something there that is amiss during that exam, they're going to say, hey, we should probably look into this further. But if everything looks good, you know, you're good to go.
Mm-hmm.
Was it easy to get through? I know that we had mentioned that you were very, very young and may not have total recall of every test and every procedure, but I could see a change on a day-to-day basis because they had a wide variety, and we were always welcome to come in and visit with the practice, to participate if we wanted to, and understand the different procedures they had, which are many and varied. Do you remember using a computer?
Yeah, my favorite was this just yellow ball on a string with stuff written on it. That thing was so much fun. Yes, I do remember that vividly.
Was that a computer or just a real tangible ball and
No,
string?
That was
just
a real free space ball that
Yeah,
we
it was a ball.
do things with in the therapy room.
So it's not all Star Wars stuff.
No.
Oftentimes Miss Melissa would send you home with exercises that involved
Ooh, and the eye patch. I remember the eye patch.
household items that we had.
Yep.
Is it fair to say they had a lot of different solutions to contribute?
Oh yeah, for sure. It was never a dull moment. It was very fun.
So she kept it very fun.
Yeah.
Very interesting.
Yeah, it wasn't some scary thing that I had to go do. It was an amazing experience and helped me become who I am today.
Thank you so much for being here, you guys.
No problem.
Well, we owe you the thanks. It's a debt of gratitude that's hard to measure. How important this was, how great it turned out, and some things in life are almost too good. And to go from where we were to where we are now is a miracle to me. We're extremely thankful.
Yes.
It's mattered a lot. Great job. We
I
owe
know.
you from here
You
on.
guys did it.
Show
And you
your
did all
love
the
for Miss
work,
Melissa,
so.
please.
No, you.
Thanks, you guys.
Awesome.
Okay.